Good morning, everyone. Today I'll be covering a topic on early childhood caries. If a child is having a tooth pain, he'll not be able to eat properly, which is going to affect his health. So basically, early childhood caries is going to negatively affect the oral health of the infants and children. In 1996, Center for Disease Control and Prevention stated that of all the diseases that affect the humans, dental caries may be the most prevalent one. According to the first ever United States Surgeon General's report, Health in America published in 2000, dental caries is the single most chronic childhood disease. It is said that it is 5 times more common than asthma and 7 times more common than hay fever. In 1862, Abraham Jacobi first described the clinical appearance of early childhood caries. In 1932, Beltrami said this as black teeth of very young, and in 1962, Dr. Elias Fass termed it as nursing bottle mouth. So, early childhood caries has been given a definition by American Academy of Pediatric Dentistry. So, according to AAPD, early childhood caries is defined as presence of one or more decade, either cavitated or non-cavitated, missing as a result of caries or filled tooth surface in any primary tooth in a child 71 months of age or younger. The AAPD also specifies that in children younger than 3 years of age, any signs of smooth surface caries is indicative of severe early childhood caries. From age 3 through 5, one or more cavitated missing due to caries or filled surface in primary maxillary anterior teeth, or decayed missing or filled score of more than 4 at the age of 3, more than 5 at the age of 4, more than 6 at the age of 5, surfaces constitute severe early childhood caries. This early childhood caries is known by various terminologies. First one is the rampant caries of young, childhood dental caries, maternally derived Streptococcus mutans disease, that is MDS, MD, which is newly termed terminology. It is also known by various other names like nursing caries, nursing bottle mouth, nursing bottle syndrome, night bottle syndrome, baby bottle mouth, nursing mouth DP, nursing bottle caries, milk bottle syndrome, tooth cleaning neglect, etc. Maxwell in 1945 described rampant caries as suddenly appearing widespread, rapidly burrowing type of caries resulting in early involvement of pulp affecting those teeth usually regarded as into ordinary decay. Now coming to the etiology of dental caries, which you have already learned in second year. So various theories have been proposed for the etiology of dental caries. The first one is the legend of worm, endogenous theory, exogenous theory. Along with that, yeah, acidogenic theory, that is Miller's chemoparasitic theory is considered to be the most accepted theory. Then you have chelation theory, then chelation proteolysis theory, then you have sulfatase theory. Okay. Now coming to the concept, main etiological factors for dental caries, that is the three important etiological factors for dental caries are the dental plaque, which consists of microorganism, then the diet, which is the main culprit, that is the sucrose is the main culprit, which is considered to be an arch criminal of dental caries, and the host factor is also responsible for the dental caries. So all these three factors was given by keys, so that's why it is called as keys triad. And but one more factor was is added to this triad, that is the time factor, which was given by Newbrands, and hence it is called as Newbrands tetrad. So keys triad and Newbrands tetrad. Now coming to the host factor, that is the tooth. So the anatomic characteristics of teeth like enamel hypoplasia or deep narrow occlusal fissures or buccal or lingual pits, they are more susceptible for dental caries. Arrangement of a teeth in the arch, if it is crowded and irregular teeth, definitely these are also susceptible for dental caries because there is difficulty in cleaning the teeth. Immature post-eruptive enamel. As soon as a tooth is erupted into the oral cavity, it is highly susceptible for dental caries. Coming to the dental plaque, which consists of microorganisms, so Mucus streptococci is the most important microorganism which is responsible for the dental caries. They convert the sugars into acids. Now, coming to the oral substrates, prolonged bottle feeding with sugar-containing drinks and night feeding of sweetened fluid as well as frequent snacking will lead to the development of caries. Sucrose has been identified as a main cariogenic sugar. Then coming to the time factor. So ECC is related to the duration and frequency of exposure to the cariogenic substances. Other etiological factors which are responsible for the ECC is acid fruit drink, history of medical condition. If a patient is having a history of medical condition, because the syrup consists of sweetened fluids, or have a frequent the patient having frequent ingestion of sweetened medication will have early childhood caries. Various other psychosocial and behavioral issues in early childhood caries. They include infant feeding pattern, race, ethnicity, socioeconomic status, toothbrushing, dental knowledge, and stress. The first one is infant feeding pattern. You can see the picture here, child sleeping with a bottle. You can see that the child will not be actually swallowing the milk, but instead the milk which has been taken up by the patient or by the child will get accumulated in the cheeks, which will harm the dental tissues. So, use of bottle is predominant in children with early childhood caries. Length of contact becomes very important, and children with caries eliminate bottle use 4 to 7 months much later than those without caries, and prolonged breastfeeding also leads to early childhood caries. Now, coming to the race and ethnicity, certain race and ethnicity have uh, mm, uh, uh, can be associated with early childhood caries. Now, socioeconomic status. Individuals from lower socioeconomic status experience financial, social, and material disadvantages that comprise their ability compromise their ability to care for themselves, obtain professional health care services, and compromise life in a healthy environment, all of which led to reduced resistance to oral and other diseases. Stress. Maternal stress has been associated with increased physical abuse potential in the young children, and also children of mother experiencing high level of stress are considered at risk for poor parenting and neglect. Now, coming to the child temperament, the child who is showing a temper tantrums, I don't want to brush, they are highly susceptible for the early childhood caries. Maternal education becomes very important. Low maternal education is a risk factor for carriogenic feeding practices and carriogenic practices. And as mothers are the primary caregivers of the child, low maternal education is related to high caries prevalence in their children. Now, low birth weight. These children have they show more enamel defects than the children who have a normal birth weight. Now, coming to the classification of early childhood caries, which was given by Wayne in 1991, that is uh, type 1, type 2, and type. The type 1 early childhood caries is mild to moderate, type 2 is moderate to severe, and type 3 is severe ECC. Type 1 ECC is the mild to moderate one where you see isolated carious lesions involving incisors and molars. And in case of moderate to severe early childhood caries, you see labial and palatal carious lesion in maxillary incisors and primary molars. And in type 3 ECC, it is a severe type of early childhood caries where almost all teeth are affected, including the lower incisors. Then coming to the pathogenesis of early childhood caries, stages of early childhood caries has been given by Harris and Gracie Goria. Very mild, moderate, and severe. Very mild, you can see slight demineralization of the tooth structure at the gingival crest. There is no cavitation. Now coming to the mild one, where you see demineralization in the gingival tooth third, and also you see there is a moderate cavitation which is formed. Now coming to the third one, that is moderate, where frank cavitation on the multiple tooth surfaces can be noticed. In CVA1, here you see there is a widespread destruction of a tooth structure, and there is a partial to complete loss of clinical crown. Now, coming to the developmental stages of ECC, that is stage 1, 2, 3, and 4. Stage 1 is initial stage where where there is no cavitation, that this tooth is in a stage of reversible stage. Now, coming to the damage stage, this is non-reversible stage. The tooth has already have a cavity. Now, coming to the deep lesion, where here deep lesions have been already formed in the tooth structure, and the stage 4 is a traumatic stage. The tooth has weakened so much that it may end up in breaking, even if because of a slightest fall. Now, I will be showing the same picture. See, this is the stage 1, there is no cavity formation, but there is slight demineralization. Stage 2, you can see there is a mild cavity formation in various tooth. Stage 3, you can see that there are deep lesions in many tooth in maxillary anterior area. And stage 4, you can see that there are because of the weakened tooth structure, there's a partial or a complete loss of a crown structures. Coming to the clinical features, where if you see the pattern of early childhood caries, maxillary central incisors are the teeth which are first involved, then followed by maxillolateral incisor, maxillary first molars, maxillary canine and second molars, followed by mandibular molars, and least attacked ones are mandibular anterior. Now, implication: the child who has nursing caries has a high risk of developing caries in the permanent dentition too, and child with caries is also susceptible to other health hazards. Now, coming to the complications, now, as I said, you health hazards would be there, so I'll be explaining that. So, if a child with tooth pain has pain, if tooth cavity may have pain and infection, this may lead to chewing difficulty, altered sleeping habit, nutritional deficiency, retarded growth and development, anemia, and chronic disease because the child is not obtaining the proper nutrition from the foods, from the food. This will lead to high risk of hospitalization, high treatment cost, and loss of school days. Also, pain and infection will lead to anesthetic appearance, speech problems, psychological problem, reduced self-esteem, and malocclusion. Progression. Now, coming to the progression of early childhood caries to the poor quality of life, if there is an improper feeding practice, there is loss of enamel and dentin. Because of the dentin exposure, there is sensitivity to hot and cold food. So, whenever there is sensitivity, patient will not be able to brush properly. So, there will be worsening of a dental problem where the pulp would reach and pain and infection would start. So, again, whenever sensitivity is there, patient will prefer for the soft food. So, because of which poor intakes lead to poor general health, and this will lead to frequent occurrence of cold, cough, and fever, and loss of school days and poor quality of life. Now, coming to the preventive measures, now how to prevent this early childhood caries is community-based measures can be taken up by providing fluoridation at the community level, school level, and education program can be conducted. At professional measures, oral hygiene measures can be explained to the patients, regular fluoride applications, and recall visit. Now, coming to the home care method, where dietary habits can be instituted to the patient, feeding habits can be explained, and oral hygiene measures also can be implicated. Now, coming for the preventive approach for caries control is infant oral health program, parent counseling, diet counseling, pit and fissure sealant applications, and fluoride applications, and home oral hygiene method. Now, what are these different home oral hygiene methods are use of gauze in infants to clean the gum pads, manual toothbrushing and dental dental flossing, using of disclosing agents, tongue scrapers to remove the plaque from the tongue, and oral irrigators. Now, coming to the management portion of early childhood caries, the main aim of our if management for the ACC patient includes, we have to modify all the four factors in the caries tetralogy, and also management of existing emergencies, institution of preventive procedures, arrest and control of caries process, and restoration and rehabilitation. So, coming to the treatment plan, in the first visit, all the lesions should be excavated and restored to stabilize the tooth structures. If abscess is present, drain it, and X-rays should be taken to assess the condition of succeeding tooth. Collection of saliva and to determine the flow and viscosity, and fluoride application needs to be done. Parental counseling has to be done on diet and oral, and even oral hygiene instructions should be given. Then second visit, that is 1 week after the first week, where you have to analyze the diet chart to eliminate the sugars and reassess the restorations and redo if necessary, and caries activity test also is to be done. Then third visit, restore all the grossly decayed tooth, do the endodontic treatment if necessary, and extractions of a hopeless tooth, and crown should be given to all the grossly decayed or endodontically treated tooth, and review and recall every 3 months. Now, coming management part of a very mild case, that is very mild early childhood caries. Arrest the caries, explain the parent regarding the white spot lesions. Very mild means there is white spot lesions, they are remineralizable. So explain the patient regarding fluoride application, oral hygiene measures, and regarding the diet and frequent recall. Now, coming to the mild portion of early childhood caries, where there is need for intervention of the caries process. In case of uncooperative children, caries removal is done by a slow speed handpiece and restoration is attempted. And controlling active caries lesion will prevent the extensive treatment in the future. Now, in case of moderate and severe cases of early childhood caries may need a pharmacological intervention, but and if a non-pharmacological intervention, the patient may need multiple appointments and many early injection for pulp therapy and SS crown. Uh, in case of incipient or white spot carious lesion, what we are supposed to do is we have to remineralize those two structures. So that can be done using a fluoride therapy, that is professional topical fluoride therapy, and pit and fissure sealant application can also be done. Carious lesions in enamel and dentin then go for the restoration either by a technique called as preventive resin restoration, glass anomalous filling material, or a composite crown in anterior and posterior composite restoration and SS crowns. Extensive cavitation with pulpal involvement, pulp therapy has to be done with the full coverage coronal restoration and extraction with the space management. If it is if it is of poor prognosis. Now, what are the benefits of a treatment under general anesthesia? Anterior decay teeth pulpectomy has to be done. Strip crowns can be placed. This improves the aesthetic of a young child and make tremendous difference among the peer group. Posterior teeth, deep cavities are treated and restored with crowns. Eating pattern of the infant improves to a greater extent and improves the general health. Entire treatment is carried out in one visit under general anesthesia. Children will not have, these are the benefits of having the treatment under general anesthesia. That is, entire treatment is carried out in one visit. Child will not have any unpleasant dental experience, and behavior of some child improves after hospitalization of a procedure. After hospitalization procedure. So, oral rehabilitation under general anesthesia results in immediate improvement of a children's oral health and physical, emotional, and social quality of life. It also has a positive impact on the family. Thank you.